sorts of things, right?
Also someone
Versus
who's responsible, reliable, and you mentioned few of your strengths, Dr. Amina. So yeah, I think your answer was nice. You mentioned there's some traits about yourself which definitely fits the definition of professionalism.
So it was just like a small line which had 3 to 4 words. Is it okay, or do you want me to like expand it and say 2 to 3 lines more? Is it okay if
Uh,
I give small answers also?
it
Yeah.
seemed okay to me. I'm not really sure how PDs will perceive it, but yeah, it seemed okay to me
Okay, thank you.
because I did not ask any follow-up question that would describe about yourself, how you are professional. I just asked what is professionalism according to you. So the question was very straightforward. Uh, yeah, your answer was nice according to me.
Okay. Any more feedbacks if anyone would like to put in? Interview someone.
Yeah, I think I'm ready for a mock interview, and also like I'm very. Uh, this is like my second mock interview.
Okay. So, hello, Dr. Divya. How are you today?
Hi, Dr. Meena. I'm doing very good. How are you?
I'm doing great. Tell me about the weather there. Where are
Oh,
you? Where are
uh,
you? Where are you zooming from?
I'm in Baltimore right now, so the weather's kind of getting chilly, but it's not very cold. It's ranging from anywhere
thank you.
between
Sorry?
5 to 7 degrees
No, no, no. Interview. Medicine. Yeah. Sorry.
Celsius.
Yeah, yeah. You can continue.
Yeah, so it's ranging somewhere between 5 to 7 degrees Celsius. So I think it's like really beautiful outside, like it's all colorful, the fall, you know. So
Oh,
it's
that's nice. That's nice to hear. So you're enjoying yourself. What are you doing currently?
Currently I'm preparing for my step 3 exam because I'm leaving back to India pretty soon. So I'm going to give my exam in early December. So yeah, currently preparing for step 3.
That's nice. How was your step 2 exam?
Step 2 was okay, I believe. It was not it was not as expected. Like did really well on my mock tests, but it didn't quite show up in my final result. But I think it was fine, but not so much. Yeah.
Okay, tell me a situation where in your medical career where it was very difficult, where it was very difficult to showcase your clinical skill or very difficult to come to a clinical diagnosis.
Um, that's a great question. Can I take a moment to think about it?
Yeah, sure.
Yeah, so I think I want to talk about my recent rotation. So where we had like a very young female patient, she was around 34 years old. So she's been facing recurrent unilateral kidney stones since the past 10 years. So she's been seen by a nephrologist, a urologist, her primary care, so many people. And then she underwent 25 times stenting of her ureters, and your kidneys have been shocked so many times to dissolve the stones. But it was always recurrent unilateral kidney stones. So we went ahead and then they were doing a lot of diagnosis, like to see her calcium levels and like multiple reasons which causes kidney stones. But nobody could actually come to a conclusion. And I believe like I looked up a few articles on like unilateral kidney stones. It said like it could be a unilateral hypercalciuria. So I put forth this idea to the primary care physician who I was working under, and because it could ultimately lead to non-diagnosis, because if it's unilateral hypercalciuria, the urine calcium would be still normal because it's just unilateral, and her serum calcium level, everything was normal, but nobody could like find out why she was getting those unilateral kidney stones. And I think still it has been undiagnosed, but the attending really took my advice well, and he spoke to the nephrologist and urologist, and they said that yeah, we could further investigate on this particular idea, but then in that process, I had finished my 4 weeks, so I couldn't follow up really. But I think that was a very interesting and very difficult to diagnose case.
That's very interesting. So you're from, where did you do? Okay, fine. Tell me something about yourself.
Yeah. So yeah, I'm Divya Shivakumar, and I'm an international graduate from India. I come from the southern part of India, from a city commonly known as City of Pearls, because of the booming trade of pearls which happened in Hyderabad. And so I had a passion for medicine from a very young age, which was combined with my personal experiences, which led me to pursue medicine. And here I am in this interview. So recently, a little about my experiences. Recently, I finished one inpatient internal medicine rotation in New Jersey. And right now, I'm preparing for my step 3, as I mentioned before. And outside of medicine, I really enjoy to travel. I Even though I haven't traveled a lot, I really enjoy exploring different places, and I really enjoy cooking, singing, and painting. These are like my de-stressors, which I do when I feel like very stressed out. And yeah, that's me.
That's interesting. So tell me the differences between, okay, what were the difficulties when you came into the US? What were the difficulties you faced?
Yeah, so I think so first time when I came to the US was in March of 2022. I think firstly the weather was a very difficult transition because I came into New York, and New York is like pretty windy, I felt. So even if the temperatures were a little high, it was really, really cold for me. And because it was like a and I didn't get like a lot of jackets and stuff. So the weather was a very, very difficult transition. And apart from that, I think that was the first time I was living alone by myself. So it took a little time to adjust, but I quickly adjusted. And coming to my rotation, I think it was a very big transition from like physical health records to the electronic health records. So I was even though it was a little difficult in the beginning, I think I had great seniors to me in the rotation who helped me go through it. And yeah, I think within 2 days I was able to do all those by myself. So these are like a few things that I felt like I faced coming to the US for the first time.
That's interesting. Um, Tell me a situation in your life where you gave up.
Hmm. That's a very question. I gave. Can I prepare this answer and then get back to you?
Yeah, of course, sure. Um, you can tell me, what does success mean to you?
Yeah, success, I think to me is being happy with whatever I have at the moment. Like, if I consider myself successful, if I'm really happy doing what I'm doing currently. And in the process, I think if I'm able to help others, because I feel I'm a very helpful person. Like I really enjoy when I help others and it gets some use to them. So I believe like success is something which if I'm happy doing what I do and I get to help people in every aspect of life. Yeah.
I guess I gave her a difficult time. If anyone else wants to ask her questions, please go ahead.
Can you tell me one fun thing about yourself?
Sorry,
One fun thing about yourself.
a fun thing about me. Yeah. So I think a very fun thing about me is like I really enjoy hosting people. So I feel like if people would come to my place, I think they really enjoy coming or like coming to parties that I have put up so far. So I think I'm a very fun person to be around in general. If not for like one quality, I think my personality is fun to be around.
Okay, one more. If you could trade your life with someone living or dead right now, who would it be? For one day.
For one day.
Mhm.
If I could trade my life with someone, living or dead, you said, right?
Yeah, living or dead, whoever you want to choose.
Yeah, I think I would really love to trade my life with Dr. APJ Abdul Kalam. So he was the former president of India. And I would really, really like to be in his shoes. And he has an extremely inspiring life. So I think I would really want to experience one day in his life to be in his shoes, his brain. Yes, I think he's a very interesting and inspiring person. So yeah, Dr. APJ Abdul Kalam.
If you could have any superpower, what would it be and why?
So I think if I have a superpower, it would be to like teleport so that I really enjoy traveling, like I said. So if I had a superpower where I could just teleport to any place that I want to be, I think that would be a great superpower to have for myself. Yeah.
It's tempting to say something like I would have the power to be able to cure anybody that I touch or something like that, but I don't know. Seems a bit too much.
For
uh,
me, it would be like not get tired
Yeah, you'll
without
be
having to
exhausted.
sleep. Yeah,
It'll
or
be
like
exhausting. Yeah,
eat as much as
good
I
point.
want without gaining weight, like something
Right,
something stupid
right,
Yeah,
right,
probably.
it's interesting.
right. Yeah, thanks.
Yeah, I do have a question. What do you find intellectually stimulating? Dr. Divya?
I think so what do you think is intellectually stimulating for me
Yes,
in somebody else or myself?
yourself. What do you find intellectually stimulating, which works for you?
Okay, so I think a good like mystery to solve, like I said, the previous case that I talked about. So I think such cases or such patients, I think, are very for me are very intellectually stimulating. Where I go on and on about like trying to find out what is wrong, and and I feel like I would be very happy if I can come to a conclusion as to what was going on in such a patient. And I recently also had another patient during my rotation where the patient's lungs on a CAT scan were so bad. I've never seen such a bad CAT scan, but the patient was so asymptomatic. So it was just very intriguing, and yeah, I think that is a lot. Such cases are very intellectually stimulating to me.
Okay, tell me one of your favorite books and why is it your favorite?
Okay. So I'm very interested in mystery thrillers, crime thrillers, and stuff like that. So I've read a lot of um, books about Dan Brown. So I think the Angels and Demons. I think all the Dan Brown books. I have read three of them, so I feel like they are very interesting. And why? I think because I really like such the genre. I I prefer that genre for reading books, fiction.
A follow-up question for this can be, what was the last book you read?
The last book I read was The Da Vinci Code, which was again Dan Brown's, and I didn't have a lot of time to read books. I think my last book that I read was like 2 years ago. After that, I haven't read any more. Yeah.
Like, tell me a time when you've advocated for a patient.
Yeah, so I remember working so recently I was working in a hospital back in India where one patient had come in he had come in with his son, and the patient he was feeling very dry, he was looking very dull, and the son had happened to say that he's not eating anything and he's a diabetic, so I think his sugars are spiked. So I went ahead and checked the sugars. It was super high. It was around 700 to 800. So I was telling the son that, I was explaining to him that this could be, something more than just a spiked sugar level, because the son kept denying, saying this has happened again and again for previously. He wasn't letting the patient talk anything. So I think that was one place where I had been trying to explain the son as to why the patient has to be admitted. But it was a very difficult situation to deal with because the son